Welcome back, Karen. This is another episode for the Oral Health Podcast where we're discussing and sharing some of our ambassadors' stories. And today we're going to be speaking to Charlotte, who is a tongue cancer survivor and has shared her journey online with countless different people across social media, as well as done lots of really exciting work with us on raising awareness, specifically on tongue cancer in younger people. So Charlotte is 26 and has been through a tongue cancer diagnosis. And as you'll know, Karen, being a dental expert, that's very young.
It is young, yeah. I mean, we wouldn't have put her in a risk factor for oral cancer, certainly by her age, which is why it's really, really important to not say, "Oh, I'm not in a risk factor. I'm not in a risk group, so there can't be anything wrong." I think you've got to be aware that it could be anybody, any age, any sex, you know anybody can get it at any point in time. So that's why it's so important to keep a check on everything that is going on in your mouth, and any changes are checked out.
Yeah. And amongst all of the information she shared about her journey, her time in intensive care, her time with the tracheostomy, like breathing tubes, and she was so open about that experience. But then we also started to talk about the age side of mouth cancer, and that there is, unfortunately, I'm trying to think of the most diplomatic way to say this. So there can be a little bit of age discrimination with mouth cancer. So, like you say, based on her age, we wouldn't necessarily put her in a risk factor group. And her cancer was passed off by her dentist as, "Oh, it's you've got a bit of a sore patch there, but it's probably because your teeth are rubbing against." So the dentist did not pick up on the mouth cancer, and it wasn't until she went to a GP, and that led to a delay in a diagnosis. And there was a question there of if she was older or just a different person, but with the same symptom, would it have been picked up? And it was a really interesting point, because we are seeing the age of diagnosis get younger and younger and younger. Now, 26 is really young to get diagnosed with mouth cancer, but like she's shown, it's possible.
Yeah, and we certainly should be looking, as a dental profession, we shouldn't be just dismissing somebody's sore in the mouth, red or white patch ulcer that hasn't healed within 3 weeks. We shouldn't be dismissing that patient because we think they're too young. Anything, regardless of the age, it should be referred if you can't put it down to something else, or it hasn't healed quite quickly. Again, it may be nothing, but it's better to be diagnosed by an expert early on than wait until it's more severe or a higher sort of stage of the cancer, just purely based on the age of the patient.
Yeah. And Charlotte was a really good person to speak to, and she's done lots of stuff for us since talking to her. And I know that she's so happy when people get in touch and say that her story's helped someone, and she just genuinely enjoys helping people, which is just such a nice thing to find, especially with mouth cancer sufferers, or any cancer sufferers really, that the community is there and there's people that you can go to who have been through the same thing for support. And we'll link some of different support organizations we discussed in below, and as well as Charlotte's information if you want to go and look at her story in more detail, as well as more information about the campaign, so our social links and things like that. But yeah, it's just so nice to talk to different people about their experiences. Okay, so Charlotte, do you want to just spend a little bit of time giving us some information just about you? What do you like to do? Where are you from? All of that just lovely stuff.
Yeah, sure. So, originally from Midhurst, West Sussex, which is a really tiny little town, and me and my boyfriend bought a house a couple of years ago in Petersfield. So I'm now in Hampshire, but it's only like 20 minutes from Midhurst. And I used to be cabin crew, so I did that for 5 years, and then I took some time out and went backpacking. And then COVID hit and had a little rethink and ended up applying to go to university. And now I'm studying to be a midwife in the University of Surrey, which is Guildford. So yeah, and I've just found out I've passed my first year actually a couple of days ago. So
Oh,
really
amazing.
yeah. So 2 more years and then I'll be qualified midwife. Yeah, I've got two furry kids, two smelly dogs. um, and yeah, live with my boyfriend, really close with my mum, got my little brother as well. He's 16. My boyfriend's really into motor racing, so we're always doing that. Always going here, there, and everywhere with the cars. Lots of petrol heads in my family. But yeah, just spare time seeing my friends, love cooking, walking the dogs, go to the gym all the time now that I can again. Yeah, that's it really.
Nice. And congrats on passing your first year
Thank
of
you.
uni as
Oh my
well.
God, so relieved. We got an email through and I was like, oh, I don't want to look. But yeah, I did try really hard, so I'm really chuffed.
Oh, fantastic. Well, obviously we met because your mouth cancer story has been in lots of different pieces of news. So like the
Mm,
Metro, the Independent, and you were very candid about telling your story with them. So obviously we reached out and got in touch with you to see if you'd like
yeah.
to spend some time with us and do some awareness activities. And we're all
Yeah.
really happy that you said yes. But if we can start from the beginning of your story, your experience,
Mhm.
what were sort of the initial signs or when you started to think maybe it was something a little bit more serious than
Yeah.
initially thought?
Okay, so I had some ulcers for about 3 to 4 years before I had my operation. And actually also got celiac disease. So I do get run down, and often ulcers are a sign of celiac disease. They just come hand in hand. And also I was flying, so I was always jet lagged. So I put it down to that. They came and went, but always in the same area. They never fully went, but they used to flare up. Like if I was run down, I'd think, oh, or I was hungover or anything like that. They would get worse. So they came and went. So I thought, it's nothing to worry about. And then about a year before I had my operation, I went to the dentist and they said, oh, I don't really know what it is. Might be because your teeth are rubbing. So we would advise maybe getting your teeth straightened and have your wisdom tooth taken out. So I did that, paid for braces, got my wisdom tooth taken out, had really great teeth, but still had the ulcers. So then my mum got poorly in the September, which was September 2020. And my ulcers got really bad then. And I thought, I'm stressed. It's got to be, I'm really stressed. Mum was having chemo and had lots going on. So I put it down to that. And come the January, they were really bad. Like I could see white patches. It was just underneath my tongue. And when I had spicy food, it hurt to eat. And sometimes if I was really run down, even talking, it was really sore. But they just felt like ulcers do, but just a bigger patch. And they started to turn white and they had like red around them as well. So they looked quite like inflamed. I thought maybe it was a bit of an infection or something. So my mum went, just go back. And I kept badgering me, just go and get peace of mind. It won't be anything. I was like, all right, I'll go. So I went back to the doctor in January 2021. And he said, oh, I'm going to do a biopsy, send you off, go and get a biopsy, just to be safe. And I was like, yeah, okay, whatever. I'll go and get that done. So I had the biopsy done in April. 2 weeks later, they brought me in, and I remember saying to Tom, it's fine, you wait in the car. They're probably just going to give me some like oral mouthwash or something, try and get rid of I thought it was something like I'd got a bit of an infection or something, or I was going to say they'll tell me my iron's low and I'm lacking in something. So anyway, I went in and he said, have you got anyone with you today? And I was thinking, yeah, Tom's in the car with the dog. And he was like, do you want to bring him in? And I just looked at him and I said, it's not good, is it? And he was like, no, it's not. And I thought, okay. I said, it's not cancer, is it? Like that. I was like, it's not cancer, is it? And he was like, I'm really sorry, you've got cancer. And I was like, what do you mean? Surely not. And I think I almost laughed because I was so like, no, like I just turned 26. So realistically, I'd had the ulcers at like 25 years old. And I thought, no, that's not that. I can't have cancer. That's ridiculous. My mum's just got over it, and that wasn't linked, by the way. We had lots of testing done. That wasn't linked. It was just a fluke that I managed to get it at the same time as her. So anyway, they told me it was cancer. I just remember every single detail about that room. And even now when I go back in there, like, shirt comes off, I'm sweating. It's really hard, and they're amazing in there, and the surgeons are like my friends. I feel like I can ring them if I'm worried about anything, and they always say, we love seeing you, Charlotte, but we hate seeing you because you shouldn't be in here. That was kind of a bit of a mystery to them, to be honest, because I'm really healthy. I have the odd glass of fizz if I'm celebrating or whatever, but I'm not, I don't drink, don't smoke, so it was a massive shock. So anyway, 2 weeks later, they brought me back in once they'd figured out a plan, gave me a date for my op, had my op on the 7th of June, and had to isolate before as well because COVID was still quite a thing. And I remember I couldn't see my mum, which was really hard because I lived with Tom and he was going to take me down there. So they said, just stay in your household sort of thing. So that was hard. And they kind of softened the blow a bit, I think, by saying, you might have to have this tracheostomy, you might have to have this, that, and the other. But they said to me, you will be having treatment. Like, you're so young. We want to give you the works. We don't want this coming back. Basically expect all of that once you've had your op. So when I did go back after my op and was like, right, come on, how much radiotherapy am I having? When's it starting? And they actually said, actually, we don't think you need it. We've taken the tumour, we've taken the really good margins around the tumour, and it wasn't in my lymph node. So we don't think it's necessary to give you any treatment. So that was amazing, because I've since read stories, and the radiotherapy is like the worst. I think that's what really messes with your speech and stuff and your taste, and that, like, I feel so grateful. And I think for me now it's a realization that the fact that I went when I did was the best thing I could have done, because God, if I'd even left it 6 months, who knows, it could have grown. And I mean, even in 4 weeks it had grown from when they did the biopsy. So yeah, I just feel so lucky that I went when I did, because although it felt like the worst thing in the world at the time, actually looking back, it could have been even more horrific. But yeah, my op went, it was about 9.5 hours long. And then what they did was they took the tumour from my tongue, and they also took my lymph node out to be sure, just in case it had gone there, because they couldn't test that when they did the biopsy. So they took it all anyway, just to be safe. And then they reconstructed my tongue from my leg, took all the blood vessels and like a skin flap. I don't know why they call it that, it's awful, but they took a skin flap from my leg, and they made my new tongue. And it took so long, because what happens is they sew up all the little thread vessels underneath the microscope. So it's like, it's crazy what they do, but it takes them ages. And what had happened, unfortunately, when I'd come back around, I had a Doppler, which measures like the pulse and the blood flow in your flap. And I remember them saying really clearly, it's cold. And I was thinking, what's cold? And I had all these fingers in my mouth and torches and contractions, and it was all a bit of a blur. I was just rigged up with all of these things like some sort of science experiment. And they said, oh, let's change the Doppler, it might be the wires. So they did some other stuff and changed the Doppler, and they were like, no, it's cold. So what had happened was some of the blood vessels had got damaged and caused a blood clot, and there was no blood going to the skin flap. So I had to go back in. And I mean, I don't know how the surgeons done it because it's the same surgeons. They come back in, had a nap, come back in, redid it. And I think about 4 hours later, I'd come back out and it was successful and it was working and it was fine. And they took, there was watched my every single move 24/7. I had a nurse next to me the whole time. They were brilliant. But yeah, I was just rigged up, and they put a clock in front of me, which was like the worst thing because I literally was there in intensive care for a good 4 days, clock watching basically. But yeah, I had drain out of my neck, drain out of my leg, catheter in my leg for the pain, a normal like urine catheter. I had cannulas in each hand, had my tracheostomy, which they said I was going to have for a couple of days. Ended up having that for a week. But it's fine. It saves your life, doesn't it? It has to be done. But I honestly felt like I must have looked like an experiment because I was just didn't look like me. My whole face was swollen. Everything was like just huge. And I was just had tubes everywhere. I had a feeding tube, I had an oxygen tube, I had a tracheostomy, I had drains, and yeah, my mouth was just full of tongue. But yeah, luckily had loads of help afterwards. Had loads of therapy, like speech therapy, dietitian, physio, so many different doctors, counselor, like everyone I had, and they were just incredible. And yeah, every day got easier. Every day I had a tube taken away, went onto the ward, and just got better and better really. And luckily didn't have any treatment. And yeah, I still feel like, even when I think about it now, my heart goes because I think I was that close. I was so close to having that horrible treatment, and luckily I got it early enough that didn't spread to my lymph node, and I didn't have to have any treatment. I just had to have my new tongue put in, which is I'm getting used to now.
How does it feel? How does it feel, your new tongue?
So I'll never feel it. It's numb.
Mm-hmm.
Doesn't have any taste buds or anything. Obviously it's part of my leg. It was very swollen at first. It felt horrible. It just felt like my mouth was full.
Mm-hmm.
And until the swelling went down, obviously I just was quite hard to understand. But yeah, it's numb. My ear's numb. The back of my head here is numb. If I touch there, I can feel it in my mouth, which is really bizarre. Here is kind of a weird sensation. It's like when you touch a balloon, or when you've got like rubber gloves on, and you feel something like pressure, but not really a feeling. I can feel my lips, but yeah, obviously my tongue inside is fully numb, and I don't eat on that side or anything because I just wouldn't be able to move it around, because it's basically just a flap attached to my working tongue. So my working tongue now is like works in overdrive because it's carrying extra weight, if you know what I mean. But it's fine. I've got used to it. I forget, to be honest. I forget that I can't feel it. And I think because I had the ulcers for so long before that, I never ate on that side anyway because it was really painful. So I kind of just got used to it. I mean, these teeth are going to be worn down soon because it's the only side I use.
How were your experiences with things like speech therapy and that the recovery period afterwards? How did you find it?
It was hard. I could not wait to get out of hospital, like as amazing they were. Like my goal was, right, just get home. And I remember them saying to me when I was on the ward, for you to go home, we need to do certain things to make sure that you are okay at home and you can keep stuff down, you can drink, you can, all the rest of it. And obviously my tracheostomy was fitted for 7 days. So my body hadn't swallowed or breathed through my mouth in so long that often your muscles take a while to get back to that. So they listen to your swallow, the speech therapist, they'll listen to your swallow for a while, and then they'll test it. And I had to have my tracheostomy taken out. And I remember the first time they tried to take it out, I don't think my body was ready, because it was like I was being suffocated because I couldn't breathe through my mouth. So obviously they covered this hole so I could then breathe through here, and I just couldn't. It was so like, it's just like I had a mouth full of like straw or hail. It was just so hard, so husky, so stuck. I can't explain it. It was just imagine your mouth being full of sock, basically, and that was what it's like. And I remember the panic. I was like, no, I can't. So they tried again the next day, and then every day it was just better and better. But they were amazing. I mean, the speech therapist gave me lots of exercises to do. I had to have a lolly stick and resistance against it to try and strengthen my tongue. They said to me on the day I was going home, you've got to drink 4 of these milkshakes, these little horrible diet shakes, with loads of stuff in. And I thought, oh, sorry, my phone.
All right.
And I said, okay, yeah, that's fine. I was thinking, I can't drink this. This is horrible. And I remember my boyfriend coming in. I was like, can you drink these? Like, no, I can't drink them. I was like, can you please? I want to go home. Because they had to make sure that I was all right to swallow. So anyway, yeah, I had the speech therapists. They were amazing. They got me to like do certain exercises. The physio was great because I couldn't move my neck, and like I could do a little bit that side, but this side was so stiff. Obviously, where I had my neck dissection. So yeah, physio on my neck, on my tongue, on my shoulder, because they said I would never be able to do this because of the cut here. Often messes with all your nerves and stuff. Had physio on my leg. Had to do sorts of step ups and things like that. They offered me counselling, which I did accept, but I didn't really feel it was very helpful so soon after. Because, well, 1, I could barely speak to them, and 2, I kind of hadn't really processed it that much. I was just focusing on getting better and wasn't really, I don't know, I just didn't really need it that time. What else did I have? I had the dietitian. They were amazing. They rang me every week and they weighed me, and they were making sure that I was having ice cream in my milkshakes at breakfast and just trying to fatten me up, basically. And they were just really surprised, I think. I'd actually think, because I'm young, they didn't really know how I was going to recover. A lot of the people who have it are a bit older than me, so maybe it takes them a little bit longer. Or, these men that are 70 odd that have heavily smoked for so long probably do take a long time to recover. But luckily, didn't have my feeding tube in when I got home, and they took my tracheostomy out, and I actually recovered pretty well. But I mean, I was determined. Like on day 2 when I got home, I was like, let's go out, and Tom was like, are you sure? So I literally shuffled down the road like this, really slowly, but I just had to just keep going because I'm such a hate being indoors as well. But no, everyone was amazing. Like, had the surgeons ring me all the time, had the hospital check up on me. Like, yeah, they were brilliant.
That's good. I'm pleased that you've had such a good experience with all the different people that you've been speaking to and who were involved in, helping you get better. And it's nice to hear as well, recovering quickly, because like you say, sometimes it does take a while, and side effects from things like radiotherapy and stuff, which of course you didn't have to have, can go on for quite a while afterwards. A lot of the times the people that I've spoke to have had similar operations have issues with like getting a really dry mouth, or just like sensations in the mouth are completely different to what it was prior. Have you had like a similar experience?
Yeah, I do get really dry mouth, and it's funny you should say that because I just was trying to swallow them whilst you were saying it. And eating is a lot harder than it used to be, although I've got used to it now. It is, yeah, I don't eat anything on that side, and obviously I can't taste it anyway, but I wouldn't be able to chew on that side or anything. And sometimes it feels strange, like I do feel like there's something abnormal in there. And that's probably it probably is when it's drier. It almost feels like I've got something that I need to take out. It's a really weird sensation. And I still luckily have the tip of my tongue, but obviously only half of it is working. Like I can feel. But yeah, definitely I get dry mouth and just often feels like I need to take something out, like it's in the way. And they were worried actually that it was going to be too big. They said often we have to like resize it, so I'm really lucky they didn't have to do that as well. But yeah, just a weird the nerve things. Often when I'm tired, I'm more slurry because it's just, I guess I'm just working harder to speak and eat and stuff. And my lips are a little bit different now, so I can do that and not do it the other side a little bit. So it's like they actually thought I'd be quite droopy here where they cut the nerves, but it's not too bad. But I notice it probably a lot more than what everyone else notices it, just because you pick up on those things, don't you? But to be honest, I didn't care. I didn't care about the scars. I didn't care about anything. I just thought, get this thing out and then I'll deal with it afterwards. And actually, it probably was the best it could have been, really, after. Recovered really well. They did say I couldn't go to uni in September because I had my op in the June, and they said, "Oh, you won't be going to uni in September." I was like, "Well, why?" Anyway, I ended up going anyway, and yeah, get tired probably. That's another thing. Get tired, bit slurry, dry mouth, weird sensations here, there, and everywhere. But to be honest, in the grand scheme of things, I'd take that over and over again.
Yeah.
Because, you know, what could have been, and yeah, just mental. And actually, like the whole operation itself, I never knew they could do anything like that. It's amazing.
Yeah, definitely. Did you ever have any experience with things like cancer support groups or like community support? I know some hospitals have different hubs and things that people can go and use. Did you ever get to access anything like that?
No, I don't think I did. I didn't have anything like that. I just had the dietitian rang me every week and the speech therapist checked up on me. But to be honest, once I went in and they tested the tumor and they knew I wasn't having any treatment, it was just a kind of checkup every 6 weeks. They would have a look in my mouth, weigh me. They didn't really point me to any support. I kind of had to just do it, I guess. Because my mum, obviously, she had cancer, and so I kind of knew a few things, and she had loads of support. She had, but I guess it's bigger, isn't it? That's the other thing. It's more common, they say. But she was given loads of like Zoom calls with other people who'd been through it. Because I actually said once I had my operation, like, please pass my details on to anybody who wants to. Sorry, mum's got a massive bone. Anybody who wants to speak to me, because I felt like I didn't really have that. There was one lady that said she would chat to me, but I chose to speak to her after my op because I just wanted to not really know much. I just wanted to get it done. Didn't have a choice, so I thought, right, let's get it over and done with, and then process it afterwards. And the only thing I was really worried about, and I messaged her about, I said, can you voice note me? And she was like, yeah, sure. Because I just wanted to know that I wasn't going to sound really, really like you couldn't understand me. That's the only thing I was worried about. Because I know, unfortunately, it does happen to some people, but she reassured me. But yeah, I think it would have been nice to have a bit more support, because as much as the nurses and the professionals can give you, and they say they'll be there for you, if you haven't been through it yourself, you can't really explain it. And since I've sort of spoken about my story and I have spoken to others about it, like, it is a different kind of love. It's a different kind of like support that you get, because you know that they feel exactly the same, because they know exactly. Like, one guy said, I saw your video of you sipping the water for the first time. He was like, I laughed my head off because I felt exactly the same.
Yeah.
You kind of can't really explain it or understand it unless you've been through it yourself. So yeah, it would have been nice maybe to have, like, they do these coffee mornings or drop-ins or that sort of stuff, or like questions, even like a Zoom call, like a Q&A. People could, if they didn't want to show their faces, they could write in there, oh, how did you feel when you had this or whatever, it would have been maybe a bit helpful to have that.
Mm-hmm. Yeah, definitely.
I also didn't really know where to look,
Mm-hmm.
really know what to search for, or
Yeah, of course. Like it's you've put that really well. Like you can't always explain something as well as someone who's been through it. So like
no.
you can get all the advice in the world, but it still doesn't, it's not as good as someone who's in the same position or has been in the same position. It's nicer. I completely agree. With that in mind then,
Yeah.
if you could give any advice or any words of encouragement or anything to someone who might be in the same position,
Mm.
what would you say?
um I would say, gosh, it's so hard. First of all, like, my story just shows that the sooner you go, the better. And if you're worried about anything, no matter what age, because that was the whole stigma is, oh, you're too young, God, it won't be that, won't be that. And it does happen. And obviously I don't want to be scaremongering, but I just want to sort of tell people that, if you're worried, if you've got that feeling that something's not right, just push for it. Go and get the test, go and get the scans. I can't criticize dentists, but a lot of people have said, oh, my dentist didn't notice that. So, just go to GP, just go anywhere where they can try and get you some sort of scan and push for it. But also, like, mainly, that all of these operations are successful, and everybody who has them, they take the tumor away and they can live a normal life after. I've done so much since my operation. I'm doing a degree, I've been on holiday, I'm getting married, like, and I feel normal. I might not, my tongue's not normal, but to me, you can live your life and do everything you want to do. You just kind of process it and accept it a little bit more every day. And it's not easy. It's such a bizarre, crazy operation that you have to have, but it is amazing. And it sounds scarier than it is. I think once you're in it, you don't have a choice. You've got to do it, you've got to get it done, and it is actually fine. You can do it. It's just, try and get the support. If you feel like you need the support, don't be afraid to reach out, because maybe that's what I should have done a little bit more, but I kind of was like, no, I'll be fine, I'll do it myself. But yeah, I just would love to be that for somebody else as well, like someone in my shoes, if they're a bit younger and they're a bit kind of like, oh, well, nobody's gonna have it, because that's how I felt, was all kind of a bit older people, and I thought, well, they're not like me, they won't get it. So it'd be nice to sort of do that for somebody. But yeah, just to say, basically, go with your gut feeling, always get it checked out early, no matter how old you are. Takes literally 30 seconds to check your mouth as well, and it could save your life. And yeah, it's bloody hard, it's really hard work, but you'll get through it. I got through it, and I feel kind of normal now. But just happy to be here. And all these little things that used to bother me, I'm so over it now. I'm so chilled. Because you do appreciate it a bit more when you have to breathe out your throat for 2 weeks. And oh yeah. But yeah, that's the least thing I want to do. I don't want to scare anybody. I just want to give as much honest information as I can, just to show people that if you go earlier to get it checked out, you can then look forward, and it's all fine and it's okay. And it's actually a really treatable cancer, although it is a really bizarre one, and the operation's traumatic and pretty gruesome. It is treatable, and you can get over it and be fine. And it really does happen to anyone, not just smokers, because that's such a stigma. It really annoys me. You have to be like a really old man that smokes 50 a day, but you don't. Mm-hmm. It just shows that recently how common it is now, like, and it's not out there. It took this tiny little poster in the clinic for me to be like, oh my God, that's mouth cancer. And by then it was too late anyway. So yeah, but just, yeah, don't really know. It's hard to put it into words sometimes, what to sort of tell people. I don't want to scare anyone, but it is horrible. It's hard, but it just shows there's so many stories, so many positive outcomes, and you do get through it.
Mm-hmm. Absolutely, yeah. And you're right, it's you can come out the other side and it'll be fine. And yeah, you know, you're proof of that. You've, like I say, you're going off to uni and doing all of these amazing things, and you know, it's behind you. It's yeah.
And
Yeah.
it's hard though when somebody says, oh, I've had so many messages like, oh, how do I keep positive? How do I do this? How do I do that? You have to keep positive, and that is such an annoying thing to say, because if you're not feeling positive, where do you get that from?
Mm-hmm.
But you do, because time goes, and each day you're getting closer to your operation, or you're getting closer to getting better, or you're getting closer to feeling normal, and it's fine. You'll get there in the end. And yeah, I just would like to think that I'm proof of that. One day I was told, right, we're going to cut half your tongue out, we're going to make you a new one, and you're going to breathe out your neck. I would have thought, what? Surely I'll never do that. I can't do that. And now here I am, and I'm fine. And I feel like, it's bloody scary, but you can do it.
Yeah. That's a really lovely note, I think, to end on. So yeah, thank you so much for
That's okay.
spending the time with
Hopefully I've
me.
been useful. Sorry, I do waffle on. Now that I can talk again, I literally talk everyone's heads off. I
Don't
literally talk
worry
my tongue
about
off.
it.
Yeah, I think it's brilliant that we have such a cross section as well. So, ranging from the young to the older to the different types of cancer, to, so that the information that they can give, the experience that they have, will be slightly different in each case. And anybody looking for the information that kind of matches them, they will be able to find the help there. And we can only be eternally grateful to these people that are happy to put their story out there, and, as you say, speak candidly about their experiences, because it's invaluable. And we need this. We need it as a profession to understand, because we know the nuts and bolts of it. We know how to look for it, but we have to be aware of the patient on the end of it. We have to kind of sort of be able to empathize with what they're going through. Okay, the main objective is to get rid of the cancer, is to stop those cells from spreading anymore. But obviously catching it earlier, it has a better outcome for the patient. But also, there needs to be the facilities there to support the patient through the whole of their journey. So not just getting rid of the cancer cells, but looking at the holistic approach to the patient. So right from the start of being diagnosed, right the way through, for all the emotional and all the other aspects, like the post-traumatic stress disorder, that lots of people can get following the treatments. There needs to be that kind of support and help out there.
I couldn't agree more. And yeah, like I say, we'll link all the support organisations that we are aware of. And actually, on the mouthcancer.org website, there is a section of support services broken down by area, as well as ones that cover everyone nationally and internationally. So, yeah, thank you again, Karen, for talking to me. Thank you, Charlotte, Stephanie, Laura, everyone that we spoke to. And yeah, just stay vigilant.
Absolutely. Thank you, Sophie. Thank you for all your help on this. And, I know it's been difficult for you to interview all these people, because it is a quite emotional subject. And we do want to be at the forefront of helping these patients and getting the awareness out there. And it can be sometimes, if we're not used to it, and certainly, and not from a dental background, I know it can be quite an emotional journey for you to learn about it as well. So we do appreciate that as well, Sophie.
Oh, thank you. Well, yeah, I'll leave you be for now, Karen, and thank you once again.